Hi everyone, Aaron Brooks with Perfect Postures. Today I want to talk a little bit about something a little bit more complex than we've talked about in the past. And a lot of the things that we do here at Perfect Postures are trying to figure out what the ultimate cause is for a particular issue that someone may have. And the body's amazing. It's going to always find ways to develop compensatory either positions or actions for something that's not working properly in the body. So what I always tell people is that your body's going to take the path of least resistance. So you're going to move from point A to point B as efficiently as you can. Whether you have to limp over there or hop over there, you're going to do it just whatever's easiest for your body. So we had a case come in today. A client came in with low back, left low back, left knee pain, right at the joint line, and then upon asking him some questions, he had sprained his ankle really badly about 6 months ago. So right off the bat I'm thinking, okay, well, more than likely the ankle is going to be a contributing factor, and sure enough there was a lot of things going on. But let me just kind of give you a rundown of what we found. So when we're standing looking at his front view posture, his pelvis was rotated left to right. So that means his left side of his pelvis was forward of his right side. Now, that's important because what happened to his left hip joint, his left hip actually turned outward. His left foot was turned out, yet his left ankle, or his subtalar joint, was actually collapsing inward. So his symptoms were all on his left side, and when we looked at his gait pattern, I noticed that he was toeing out and he wasn't able to get proper toe off. So I know there was something going on within the joint that was obstructed. Now that's important because as that's obstructed, now because he doesn't have toe off, he actually wasn't able to get proper hip extension. So his left hip wasn't able to come in back of him. So in turn what was happening is he was actually getting too much tilt in his pelvis, which was making his low back arch too much. So two things we went after. One is I wanted to get the rotation out of the pelvis because that was really critical, but also because he didn't go through the proper rehabilitation after he sprained his ankle, he didn't do anything about it. He just let it heal. He never addressed what the joint, the ankle joint, and in particular what the talus bone was doing in the ankle. So we want to show you an exercise today, a corrective exercise. This will be the corrective exercise for the week. As soon as we got done with this program, he couldn't believe the difference. He had no pain in his low back, and all we really went after was, again, the rotation of his pelvis and increased mobility in his ankle. When I say mobility, we did both plantar flexion, where you point your foot down, and dorsiflexion, where you pull the foot up. So anyways, that's a little more complicated, but these are things that we see here at Perfect Postures. And again, this was ankle pain, knee pain, hip pain, and low back pain, all on the left side. So stay tuned for the corrective exercise of the week, and we'll see you soon. Thank you.